Let's go live to Canberra now, and joining us is Dr Nick Coatsworth. Doctor, good to see you. Thanks for your time as always. So just casting your eyes down to Victoria, it seems as though Delta is getting away. Is there much more they can do to stop it?
Well, Pete, I think this is just an important example for all of Australia that the Delta variant is extraordinarily difficult to keep the lid on, and so to speak, once the genie's out of the bottle, it's just it's very hard to contain. What more can public health officials do? Well, it's very much about targeted interventions at this point, where we know that there are Australian communities where the virus spreads more readily, and they're the communities that we have to focus on and give our full attention, not with more rules and restrictions, but with the support to get vaccinated and the support to be able to stay at home and abide by the restrictions whilst we get the numbers under control. But vaccination, of course, is the absolute key here, Pete, the absolute key.
Yeah, and I had the Treasurer on the show this morning, and you'd be aware of his push at the moment, has been for the best part of the last week, urging premiers to stick to that national plan. But you'd be aware also that some are resisting that. Mark McGowan in particular, Anastasia Palaszczuk too. They want to keep the COVID zero situation where they are. But, I mean, is Victoria proving that it's a fallacy?
Well, I think that is the case, actually, Pete. It is exceptionally difficult to keep COVID zero now. But, you know, there's things about these border policies that don't make a lot of medical sense. In particular, the lack of compassionate access from Australians living in New South Wales to relatives in Western Australia. You know, Pete, there is a way to actually get someone safely to see a dying relative. You do a risk assessment, you choreograph their visit, you have them in PPE. You can test them every single day for 14 days if you want to. It's perfectly logistically doable. So even some of the measures to keep states at COVID zero are really you know, it's quite excessive. And as someone who, you know, I didn't get to see my own dad's dying breaths when he passed away in about 2012, I can tell you that sort of thing lives with you forever. So yeah. I just think some of these measures really have to be reconsidered.
Can the hospitals handle the influx that will inevitably come?
Well, there is no doubt at the moment that the hospitals in Greater Sydney are under strain and stress. There are exhausted staff. However, when we look at it at a whole of system level, there are many more ICU beds than are actually occupied at the moment. We haven't approached surge capacity in any sort of state jurisdiction as far as I can see so far. And you hear a lot from commentators that we might be faced with situations like New York or Italy in 2020 or UK in 2020. You know, the stories I heard from New York in 2020 were near complete systemic collapse of the healthcare system. And I can reassure viewers that is not going to happen in Australia right now. We are at the steep part of the what we call the S-curve of vaccination. That means we've got some of the highest rates of vaccination ever seen in the world during the COVID-19 pandemic as we speak in Australia at the moment. And as soon as we hit those marks, in fact, sooner we're going to see a reduction in hospitalisations in New South Wales, and that's the marker that we need to have a look at.
When do you expect that curve to flatten in New South Wales?
Well, in terms of the hospitalisation curve, I think, you know, I put out on social media a week ago that it would be in 2 weeks. So I've got a week for my prediction to be proved right or wrong. But I think we can be completely confident from the data that's emerged around the world that once you get to, you know, even 50, 60% of your eligible population vaccinated, that's enough to start putting the brakes on the hospitalisations. And by the time you get to 70%, 80%, then that's reducing transmission. And certainly in combination with the restrictions that we've got at the moment, we should actually be able to see numbers start to plateau and come down at some point in the coming weeks.
So just so if some states like New South Wales and Victoria, their vaccination rate's surging at the moment. Say they get to 80% and they start to ease restrictions. Do you see any issue with that happening in New South Wales and Victoria in particular, where they start to get on with things while other states catch up. Do you think that that's possible?
Well, I think it's not only possible; it's probable, and if that's what it takes to demonstrate that there's a way to live with COVID in the community, then that's what it will take. We're a federation, and we learn from each other. And I think New South Wales and the Eastern Seaboard, minus Queensland, will be the sort of crucible where we understand what it's like to be living with COVID-19. Yeah. And lifting some of those restrictions, like school restrictions, which are so difficult and devastating for primary school-aged children in Australia at the moment.
And just moving forward long term now too, Nick, I mean, eventually we're all going to get it, right? We're all going to get COVID, or a great majority of us are going to get it.
Yep, that's exactly right. Now, the trick is you want to get it when you're vaccinated.
Yeah, sure. So if you are vaccinated and you still get it, I mean, are we going to have to quarantine still for 2 weeks?
Well, look, it's possible at low numbers that we may still need to have test, trace, isolate, and quarantine throughout 2022. That's entirely possible. It depends what's happening with the hospital system in the main, but you can understand that might not be too much of a burden, particularly if the numbers are low. What we really need to be looking at is vaccinated Australians who don't get COVID-19 and what they can be doing. And I think there is very real prospect that vaccination will allow more freedoms, not to the exclusion of your participation in society, but some freedoms that are not available to those who aren't vaccinated.
Okay, and just finally, why is it taking so long to get vaccine approval for those under the age of 12?
Well, it's about the evidence, and we really need to be careful with this, Pete, because, clearly the vaccine is safe, effective for over 12s. The TGA has made that recommendation based on the international experience. But the Moderna vaccine, they were talking about doing trials in Australia on children under 12. Now, if that vaccine is still in the trial phase, we're not ready to bring it in for under 12s in Australia. And the other thing is we just have to be very measured in understanding the COVID-19 impact on kids. It's about 0.2%, the hospitalisation rate based on the Sydney experience with respiratory problems. And that is low for a childhood respiratory virus.
Nick Coatsworth, good to see you. We'll talk to you again soon.
Thanks, Pete. Cheers.